So we're going to go now to naloxone, and then we'll follow up with treatment. So Charlie?
Thank you, Lori. Like I said, my name is Charlie Curley. I'm the Atlantic County Alliance Coordinator. I oversee 19 municipalities throughout Atlantic County, provide grant money to them for drug and alcohol prevention programs. I work mostly with most of the people on the panel here tonight. Also, too, one of my countywide programs is the Just In Case Naloxone Awareness Program. And what that program is, that we realized about 2 years ago, the epidemic and the overdose problem that was occurring in Atlantic County. Just to give you a little insight, as of today, 8:30 this morning, Atlantic County has 50 overdose deaths, and they're only preliminary numbers based off the facts that the state police medical examiner and the state police forensic unit are anywhere from 6 months to a year behind on analyzing the specimens and the cases that are coming through their labs. So these are tentatively right now, but as of this morning, we have 50 overdose deaths in Atlantic County. And based off the reports that I get from Iraq, I receive the daily reports from Iraq. One of my jobs is I track what's on the streets of Atlantic County, and I also track all the overdose deaths that are occurring in Atlantic County. They expect these numbers to double or triple within the next 6 months before the end of the year. And you say, how does Narcan work? Well, Narcan, what it was, we determined that it's better to have the tool and not need it, as opposed to needing it and not having it. And that's where the Just In Case Awareness Program came about. The program is to teach people about what overdoses are, to break through the stigma, because that's the word that, it's what I get from the parents I communicate with on a weekly basis. When they call me up on a Monday after a weekend and they say, how can we get to Narcan training? We just lost our son, we just lost our daughter over the weekend. And the thing is, they're afraid of what people think. They're afraid of, and like we've heard here tonight, who's the addict? And the question I have for you tonight is, take a look in the audience. Can somebody in the audience pick out the addict in the room? And the fact of the matter is that addiction is affecting everybody from jail to Yale. And what we did is, our training is free. The training is free to all Atlantic County residents. It takes about 2 hours. We provide the kits, the training, and the knowledge you need to save a life. Out on the table in the lobby, you'll see our latest and greatest Narcan kits. And the best one we have now is where it's just a matter of opening up the packet and administering it. In 20 seconds, you can save a life. Also, too, as part of this, our major pharmaceutical companies in the area, CVS and Walgreens, provide naloxone over the counter without a prescription. It costs approximately $80 from CVS, and it costs approximately $100 from Walgreens to get a dose, a 4 milligram dose of naloxone to save a life. But the thing is, we offer it for free. So if you have a church group, you have a PTA, you have, a bunch of neighbors that want to get together, the flyers are out there in the thing too. Contact my office. We have 2 upcoming trainings. One will be in Egg Harbor Township. I believe it's October. We have another one in Hamilton that's going to be at the Family Success Center in September. The flyers are out there for that. That's the impact that this work has on me. I see it day in and day out, and it catches me off guard. Right now in Atlantic County, there's only 4 police agencies that carry Narcan. Galway, thanks to Donna Hibby, Pleasantville, Atlantic City, and the Sheriff's Department. Also, too, one of the initiatives through Atlantic County government and through my office is that we have placed Narcan kits in all Atlantic County buildings. So when you go in, they're placed in a defibrillator box. So when you go into an Atlantic County building now and you look for the defibrillator, you'll see this sticker. It's bright red orange. It says emergency naloxone kit. And that was one of the initiatives that we saw working with our legislator, Assemblyman Mazzio. We started off with all Atlantic County facilities. Our next goal is to work with all the schools in Atlantic County, the superintendents, through Assemblyman Mazzio's office. And I applaud Assemblyman Mazzio for taking the initiative to introduce the bill, because that's what we need to force it into schools. Because once again, that, not in my school, it doesn't occur. I want to applaud Buena Vista Township because the majority, a lot of their staff, their SACs, their school nurses have all attended to training as private citizens to be prepared for when the law becomes effective, hopefully in the fall of this year, that we bring it into the schools. And the people think it's like, well, why are we bringing it into schools? It's not the students that we're most concerned about, it's the parents coming into the school. And like we've heard here tonight, this epidemic affects everybody, all walks of life, young, old, they're dying. They're dying, and like it says, in a very epidemic proportion. So we suggest, and once again, it's better to have the tool and never need it as opposed to needing it and not having it. Thank you.
Thank you, Charlie. And next, we have two representatives from Seabrook House. First is the medical director, Sherry Daisy, and then Sean Collins. Okay, Sean, come here first.
Good evening, my name is Sean Collins. I'm an addiction medicine representative from Seabrook House. I'm here with Sherry Daisy, who is Director of Medical Services, who is going to be talking about the medical side of the treatment. But just to give you a little bit of background about Seabrook House. Seabrook House is an internationally recognized, CARF-accredited addiction treatment and co-occurring mental health treatment facility. Seabrook House is a nonprofit. We've been helping families find the courage to recover from alcoholism, drug addiction, and compulsive mental health disorders for over 42 years. We currently have 4 locations, one right here in Atlantic County in Northfield, our main location located in Bridgeton, Cumberland County. We also have Cherry Hill and Morristown up in Morris County. And coming very shortly, we're about to open another location in Monmouth County, just because the need is so great. We offer full continuum of care for treatment, ranging from inpatient services, withdrawal management, and residential treatment, as well as outpatient services from partial hospitalization, intensive outpatient, and traditional outpatient. We have a wonderful extended care services for women called Changes, 90 days or longer treatment for women. And one thing that Tracy mentioned, substance abuse is a family disease. We offer services at Seabrook House called the Family Matrix Program, which is a 3-day program that really helps strengthen the bonds between families and their loved ones that attended by, their siblings, significant others, family members. Anyone can come to these Family Matrix programs, whether they're a patient of Seabrook House or not. And that's one thing that Seabrook House strives for, is that we can help anyone in need, not just patients that qualify for Seabrook House, but also patients that may not. We take the extra steps. If you call us, we'll do our best to get you into Seabrook House. Just to give you an example, we get on average anywhere from 4,000 to 6,000 calls per month from patients and families seeking treatment. We do our best to help everyone, but in a case where we're not able to assist that person, we help find resources and provide placement in other areas for those patients. So one other thing I'd like to talk about is the medical education that Seabrook House has been providing. You talked about the medical. Sherry Daisy, Dr. Joseph Ranieri, and our medical team, we go across the state of New Jersey providing medical education in various medical societies, such as the Medical Society of New Jersey. We have New Jersey Osteopathic Physicians and Surgeons, ranging on various topics from identifying and addressing addiction to screening and brief interventions, just to name a few. And with that, I'd like to introduce Sherry to talk more about the medical side of treatment.
Thank you, Sean. I don't know if my mic is working. Hi, welcome everybody. Thank you for coming and joining us. As Tom had talked about his son, I was also that child. I was the perfect child. I've been in long-term recovery for 11 and a half years. I went to Christian college. I was a perfectionist. I was into sports. And my parents said, not my child. My father was a police officer. I lived in a perfect household. No one had addiction. So when my parents were dealing with it, it was go get some help. The problem with that is it's a family disease. And, until we got family help, it couldn't, be started. So my goal, it's giving it back. And I'm here that there is hope. I had to fight back. I've been doing this for 11 and a half years now. And, recovery is an awesome thing and a fantastic life. But it is a daily We go step by step and we do day by day. But this has been my platform. I'm here to help, especially when families are coming in, and they're dropping off their family member. It involves the family. It's not that you did something wrong, as you talk about. My parents were good parents. I made really bad choices, and I got hooked up with really bad people. And I was involved in youth group, and I did all that. And, for me, there was something missing. And part of that is, we strive to be perfect. We strive to be, the kid that everybody wants and looks up to. And that pressure, along with, depression. We're dealing with anxiety disorders, depression right now, with substance abuse. Number one is depression. We're looking to fill something. So one of the things that we deal with is, our psychological services. We've got to get to the root, find out what's going on. When patients come in, the average substance abuse right now is 4 different drugs. That's an average. I had someone come in recently, 6 different substances. They don't know if they're up or down. They need an up to come down. They need a down to go up. This is somebody coming from a middle-class family. The family had no idea how this happened. They're barely able to walk in the door. We've got to put our arms around them and get them through treatment. But we've got to detox them. We've got to get them to a baseline where we can even start to begin to find out what's going on. We do an assessment with a psychological to find out. Trauma is number 1. We deal with rape. We're dealing with molestation. We're dealing with all those things that have happened in lives that nobody wanted to talk about, and it's coming out now because they were stuffing it with a substance. And in families that, family would say, well, no, not in our family. Yeah, in our families. And it's coming to that realization. These things are happening, and that shame that our patients feel. I'm the first person, I like to greet a lot of the patients, look, there's hope. You can overcome this, and you can have a fantastic life. But we got to get you through treatment. We got to get you to a place where you like yourself again. You didn't wake up and someday want to say, I want to be a heroin addict. The biggest thing we find is a back injury. Everybody has a back injury. It doesn't matter what age, 18 to 80 right now, we're dealing with. I have 78-year-old heroin addicts that did heroin back in the 70s. Can't get painkillers anymore. They go back to heroin. I say to them, it's not the heroin that you used back in the 70s. It's different. Can't get opiates anymore. Our education now is, we're running the prescription drug monitoring program. We're confronting, we're getting consent signed. We're calling the doctors. Listen, you've got your patient here. What are you doing? We've got to start holding them accountable because it's out of control. We're following up when they leave with their physician. We're getting doctors where we thought they would never respond to us. They're calling us. Thank you for letting us know. You know what? I didn't realize it. Pain management, number 1. That's where our patients are coming from. They got kicked out of pain management. Heroin. It's the next gateway. And the biggest thing is it's the heroin, the opiates, and it's the benzos. The Xanax. Everybody comes in, it's a Xanax. A Xanabar on the street, they're calling them. Doesn't matter what age, that's what they're using. And they don't see this as a drug. And this is the scary part because we got to get them through withdrawal. Because the highest increase to die from a grand mal seizure is from a benzo. And alcohol, the alcohol withdrawal. So we got to get them into some kind of treatment where they're being medically monitored. And this is what, we've got to get everybody on board because this is the reality. People with DTs and we're seeing the alcoholics and, it's scary. We've had multiple people in their 50s going to respiratory arrest from alcohol withdrawal or Valium. They didn't tell us they were using Valium for 10, 15 years. And this is what's happening. And, we're seeing them and they're not healthy at this point. So we want our young ones to see when they see someone in their 50s, 60s, and 70s that has a walker, they're in a wheelchair. This is what the body has done. The liver disease, we're treating them when they're in there. If we have to send them out for cirrhosis, we're treating them because this is the reality of what this epidemic is doing to our young people. And, it's a good reality check for them to see that because it doesn't look pretty. Right now you're just dipping and you're dabbling in it, but later on, it's ugly if you survive. We hear every week from someone that left our program that overdosed and died. They didn't go to outpatient. They didn't follow the program. They didn't follow a meeting. They didn't follow up, with checking in with their families. And they overdosed and they died. Again, with the family program is the counseling. How not to enable? Because we all want to enable. It's easy. My parents enabled. We'll figure it out. You don't need to go to treatment. It was that one time that I said, you know what? I need help. That finally got me there. Or I would be dead. And I know that. But, we've got to start somewhere. And again, with the Narcan, we get a lot of criticism right now because we're doing the Narcan. You ask a heroin addict that comes into treatment, do you like Narcan? No, they don't like Narcan. The uneducated public that doesn't know anything about it thinks, oh, well, that's just a crutch. It's not a crutch. Because if my child needed Narcan and I was able to have it and I could have saved them, then I would darn well want it. We make sure that we get it for every patient that comes in for opiates, and we give it to the family when they're discharged. And we tell them, this is for you. And we hope it expires. We hope it does. But what we've been able to do is when we get a refill request, we do an intervention because something went wrong. Somebody used it, whether they used it on their friends or someone used it on them. We reach out. We got to get a hold of them again. What happened? And we're finding that this has been another tool. The families, they're scared. When we go over it, I teach it to our family matrix program. Their faces just drain when you tell them about it. And, we tell them, if you had the chance to save your child, and, we're going to give you that chance, why not take it? We also offer the Vivitrol shot. Vivitrol is an opiate blocker injection. We're just finding out going forward that Vivitrol is going to be offering 6 months free for Medicaid patients, which has been unheard of till now. Yes, for those that can't afford it. That's how important they feel this drug is working. Reduces cravings 75%. This can get people through treatment and past treatment. Can do it up to 2 years. This is where we need to be. And I tell the families, when their family member tell them they can't come home unless they get Vivitrol. And ask them, because we give them a wallet card, we give them a necklace, and we give them one of those rubber bands. Ask your family member, where's your wallet card? It's your responsibility. This is part of the family dynamic. So, lots of stuff going on, and, we're so grateful to be a part of this because we're not ignorant to this. This is all around us. And, we don't find anybody, if I found somebody that wasn't affected by addiction at this point, I'd be, they're living under a rock. Because it's everywhere you go. We do this, Sean and I do this, we do this 24 hours a day. I mean, we take calls everywhere. I have the opportunity to go and speak to nurses. I speak in ERs. I speak about mental health and substance abuse. I just spoke in Phoenixville OB nurses because methadone, Suboxone in the OBs, and we draw with babies. This is where, this is the one we don't want to talk about, and this is the education that's needed. So anywhere we're needed, we go. Because this is for me paying it forward and giving back the gift that I was given, which is recovery. So, thank you.
Thank you, Sherry. Next time, I just want to invite two people in the audience to actually just kind of talk about a couple different programs. One is Kathy Granado. She's going to explain what the Triad program is. And I just want to mention, Kathy and I, we have a committee that is run out of our Join Together Atlanta County program. And this is something actually for Assemblyman Mazzio. There is a lot of issues with getting youth into treatment. As you guys all know, there is adult drug court. And there is a lot of issues with getting youth the treatment that they need. One, as most of you probably know, there is not a youth facility in Atlanta County. Every place that offered youth treatment, inpatient and outpatient in Atlanta County has closed. That is a very big issue when we are sending people out of county because there's nothing close in Atlanta County. Another issue is just the fact that when they are dealing with police departments and school personnel, that they're being given different things that they have to do, different requirements as part of adjustments, what's called station house adjustments, but having them actually being mandated to seek some type of counseling, whether it's attend support groups or actually have to go get some type of evaluation done. And there are some great police departments that are doing it in Atlanta County, and then there's some others that we're working with through the school resource officers as well as in the schools themselves. So I actually would like Catherine Granado, she's going to speak a little bit about the Triad program here in Atlanta County.
Okay, again, thank you. Like everyone else, I'm really pleased to be here. I am an employee with Atlantic County, and I run a council that is an advisory group on mental health, substance abuse, and developmental disabilities for youth. The TRIA program that Lori mentioned is really our only youth treatment option that's like publicly supported and accessible right now. If you go out on your way out there, 2 yellow flyers that I'm going to ask you to pick up, and a couple of business cards. The TRIA program sounds, try it sounds kind of like encouraging, but I'll tell you right now that the Children's System of Services is like alphabet soup. So, and I may throw some of those acronyms out there and see if I get the strange looks, but TRIA is Treating Recovering Youth in Transition. Been around for how long, Judy? 25 years or so? And this is run by it is supported by county government and also by funding from the Department of Children and Families. We have a licensed LCADC, clinical alcohol and drug counselor, and a CADC, 2 guys, and their business cards are out there, George and Jake. And they offer what's called Group 1 or Group Level 1 group therapy for youth. Kids come into this through folks like Judy, student assistance counselors in school, station house adjustments, I think, or in that early intervention when, a youth is identified probably through delinquency or truancy or things like that, they can get funneled into this. It is a free service. They do urinalysis. It's kind of hard to deny the urinalysis. So, and we know denial is a huge issue. And what kid is going to admit it, right? So that's the advantage of the TRIA program is they can do the urinalysis there, and they do a level 1 group. They do weekly programs, and the closest one for this part of the county happens at the Hamilton Family Success Center. Do you know where that is in Bellevue? Bellevue Avenue? Okay, so in Hamilton. So that's on here. It lists all of the different groups and when they meet. So Hamilton is Thursdays, 3:30 to 5. They also can do bus tickets. So, we hear sometimes parents aren't really cooperative or supportive for a variety of reasons, work and other things, and getting the youth there. Bus tickets are available through this program. So this really is the youth treatment option other than private insurance, and getting into those services. The other thing I want to tell you about, and here's some of those acronyms. Does anyone know what the CMO is, or mobile response, or the FSO?
We do, but we work in the school.
Yeah, I know you do, and that's good. All right. We have a system of services in the state of New Jersey, and the Reverend may know it's kind of the next incarnation. Everyone knows about DIFAS. This is not DIFAS. It's a sister division called Children's System of Care. So we call them CSOC. I got acronyms. Children's System of Care. And there are no bulletin boards. You don't see it advertised on the cable crawl, under the Weather Channel. But it's a system of services for mental health, substance abuse, and developmental disabilities. And the fantastic part to this is that it's 24 hours a day, 7 days a week, 365 days a year. This phone number, parents can call, youth do call sometimes. Parents can call, and they're connected in a triage process with a licensed clinician. And that's where the help starts. Because they're going to go through a series of questions, what's going on. Sometimes, and they'll tell you sometimes you need to call 911. It's one of those situations. And sometimes they'll go through the triage process, and they'll say, it's great that you're calling. We've identified these concerns, and outpatient or the services in your community are looking like that's your best option and what your child and your family needs. And then they can give you those resources, refer you to those. They can also do a dispatch, mobile response, stabilization services. They are set up to be able to, within 1 hour, send folks out to the home where they can do an evaluation of the youth, right in the home. So, and in that evaluation, there is a kind of there's a series of questions, and there is a substance abuse module that can be ticked and triggered. Another thing they may do, if it's not a crisis that requires dispatch within the hour, they can also say within like 3 days, we're gonna have a licensed clinical person available to come to your home to do this sit down and evaluation. And again, in that process, another module can be used to identify substance abuse issues. So I do want to tell you there are all levels of treatment for youth are available through these state services, but the beds are underutilized. Now, in this economy, how long can we continue to pay for beds that are not utilized? We can't. Does that mean that we don't have a problem? Absolutely not. No one I talk to believes that we don't have youth that can benefit from these openings and these services. But we've got to get the referrals. We have to have families become more savvy at identifying what's going on. We have to have school districts that aren't going to hide behind the not my school. Step up, do what needs to be done, take the role that parents need to take to, and do what needs to be done, as Chief Higbee, I believe, said. You know, you're doing them a disservice by looking the other way. Identify them. If it's not a real problem, what have you lost? You know, if it is, and you don't identify it, you lose your child, or your niece, or your nephew. So please feel free to take advantage of this. And this is mental health. I mean, that was the core set of services, was mental health. Substance abuse and developmental disability services have been incorporated under the Department of Children and Families, this CSOC division, Children's System of Care. These are yellow flyers out there. Call that number, holidays, nights, you know, they're there to do that clinical triage for you and start you on the path for help. So I'm available also. Please take the business cards for, his name is Jake Strawn and George Dannenhauer that are out there with the flyers, the Try It program, and call them and we'll help you access the services you need. Thank you.
And next up, I'm going to introduce Judy Venefro, which I'm sure probably everyone in this room already knows, but she is here tonight from Buena Regional High School just to kind of talk about the services that the school offers and what her role is.
Hi. So I've been with Buena Regional School District for 23 years, and I was very blessed. The first thing I did was introduce myself to the Municipal Alliance. So Reverend Mallory gets the blame or the credit, but Municipal Alliance really took me under their wings, and we partnered right away. So Municipal Alliance has been funding what I do at Buena Regional High School since I've been there for 23 years. So probably any agency in Atlantic County, actually in the state, doesn't want to answer the phone when they see it's Judy Venefro, because I've been very lucky. I've been very lucky with the community here at Buena and with the administration, because they let me bring in anyone I want into any of the buildings. So I have had Doug Collier from the DEA speak to our students and to our parents. I've had the Gang Awareness Prevention Program actually bring in inmates and share with the students and the parents how they got involved in gangs. I've had the Philadelphia Police Department Heads Up program. They've come in to speak to the parents and to the students. I've been allowed to have Project Pride, which is another correction facilities program, come in and bring in these people who just made bad decisions and share how addiction got them involved with crimes. I mean, a lot of school districts don't want to bring this into their building. And I've been very lucky that our Board of Ed and administration has allowed that. So I don't think that Buena kind of has their head in the sand. I have been involved with, you may not want to own up to me, Bob and Lori, but I have used and abused Atlantic Prevention Resources. They speak through all of our health classes. They do a presentation called The Fouled Up Family, and their presentation goes through all of our freshman, sophomore, junior, senior health classes and talks about addiction in the family. I have had Jake does all of the grades and talks about the progression of drug and alcohol. He comes in and speaks every year to every grade. I have every year worked with Trooper Companion, this year, but every year with whoever our school resource officer is.
I'll always
have-
answer your phone call.
You do answer my phone calls. South Star Helicopter, we have the paramedics speak through our health classes. We actually have Barb Meyer, one of our health class speakers. She could vouch for me, but they come and speak through the health classes about what emergency, what bad decision, drinking and driving, whatever the issue is, that they would be activated. We actually have the helicopter land each year in our school parking lot. Every year we have a mandatory parent prom meeting. And I mean, sadly, it shouldn't be mandatory, but I remember Municipal Alliance, the first year we wanted to get the community together. We wanted the parents to know what our concerns were in the school. And we offered babysitting. I had a group of high school students volunteer to babysit. We had the minor adjustments. We had the Darwin and Derek Minor were going to be our presenters. We put out a newsletter, if you remember Reverend Mallory. We advertised it with flyers. We made phone calls home. We had a couple parents. We even fed dinner. I think we offered food that year. So we said, this can't work. So I went to administration, who at the time was Ken Sobolewski. He didn't care what anybody thought. And I said, Ken, can we make it mandatory? And he said, we could do whatever you want. And he went to the Board of Ed, who was very supportive, and they said, we will back you, because not everybody wants to come after working all day to a parent meeting. But with their support, we sent a letter home, and we said, in order for your child to go to the prom, you have got to come to a meeting. And we offered one at night and one in the daytime, because we do have parents that work the casino and work the evening. And the first year, there were a lot of phone calls. Board of Ed got a lot of calls. Principal got a lot of calls, but nobody cared. They said, unfortunately, this was their answer, we have to preach to the choir to make sure that everybody hears the message. Now, I do believe that administration knew that it was the best of kids and the best of families that we also needed to be concerned about. But that was the response to explain why everybody had to come to this meeting. So every year, we have a speaker. This past year, Tracy Smith got to meet all of our parents, as well as our kids. Every year at this parent meeting, Late Prevention Resources has a table, what they can offer. Jake Strawn is there with his resources of how he can help families. So I think that Buena has always said, we need your help, agencies. If there's resources, we want to give you access to our kids and our families. And we are not trying to pretend we don't have an issue. And please come help us. And anyone I've ever heard of has been invited to come in and talk to our parents and students at Buena High School. I want to compliment you, Community Massio, because when Charlie Curley reached out and said, we'd like to offer free Narcan training, who do you think will show up? I mean, I did one email to all of our school counselors and nurses, and they all said, when is it? And we'll be there. So I do believe that it needs to be in every home, just in case. I certainly have a 23-year-old, I have a 21-year-old, and I have a 17-year-old. I would not be the parent that says it's never going to happen to me. I wanted to be trained, and all of our school nurses got trained. I also know that I'm most scared about our Buena kids when they're in recovery. So I also am very excited about your sober living, because that's when they're most at risk. Our most recent kid was 90 days clean. So it is when they've made a decision to do things, big healthier decisions, they've gone through rehab, they're working the program, and that's when one bad decision, one relapse, and we're burying our babies. So I do support you in both of your movements. I think I'm like a cheerleader at Buena High School, because basically my job is to just get a relationship with the kids, get them comfortable, to know that I care about them, and I do care about them. I'm not there to judge them. I'm there to find out what's going on and see what I can do to help. And then I access people that they've already met through health classes, through the parent prom meetings, and I say, hey, you remember that guy Jake that came in and talked? Remember Lori who did the Fouled Up Family, you know, the Raggedy Ann doll and the pop-up, you know, Bart Simpson? She has a program that you can do. And so now it's not like a scary thing, you know, because I think when I first started at Buena, especially for, you know, some of our ethnic families, they take care of it amongst themselves. There's a distrust, no offense to agencies, there's a distrust. And so it was really the hardest job in the 23 years was to gain that trust back and not have them afraid to come to the school and to go to the communities for service. I also found out that there's a distrust for adults. And so with the support of the Municipal Alliance, we started a natural helpers program. So what we do is we have kids identify other kids that they turn to and trust. And then we make sure, so the adults do not pick these kids. We make sure that every subgroup in the school is represented. Because the truth is, the parents, the aunts, the uncles aren't gonna know if you're doing some pills, you know, or you're trying some heroin. It's your friends that are gonna know. And so what we do is we make sure we have the subgroups represented by talking to the counselors, the different teachers, you know, after we get the votes from the kids. And we take those students away on a retreat weekend. Kim's husband, Pastor Albert and Kim, they open up Abundant Living Church. So we get the kids kind of out of the school, and we actually teach them basic counseling skills. You look sad, you look mad, what's going on? I notice you're not dressing up as much for school. You're always wearing sweatpants now, your hair's always in a ponytail. What's going on? You know, try to find out. What ideas do you have? Who have you talked to about it? Who will that hurt? You know, who else will be affected with that decision? And they're asking their friends. They're not putting their head in the sand, they're asking their friends, what are they doing? And then we're training them to understand that they're not alienating their friends by getting their friend help. They're actually saving their friend. Their friend might be mad at first, but better, you know, an angry friend than a dead friend. And we really do spend that time with the kids. We also have Stand Up and Rebel, which is Atlantic Prevention Resources supported, and we have groups that we run in the school. And it's an hour long, kind of rotated through the 9 periods of the day, so they're not just joining to get out of math, you know, class. And there's always education, but there's also community and relationships, so the kids are learning and also getting comfortable with people in the community. So I really do appreciate all that each of your agencies do. And if I haven't already had you speak at the school, you know that I will. Yeah, I would say our efforts are having kids help kids and actually putting a face and a name to the people in the community. So I appreciate what you do.
Go ahead, Charlie, did you want?
Yeah.
I just also wanted to interject that Diane Myers, who's the coordinator of the Project Prom at the Buena Vista Township Regional High School, has been the recipient of the 2016 Carrie Edwards Award for Municipal Alliance Volunteer of the Year for the state of New Jersey.
That's great.
Many years ago, each Board of Ed was asked to send a representative from the school because there was a movement to keep our kids safe graduation prom season. And that first year, Diane Myers' son was a senior in high school. They're all grown and have children of their own, but she has continued to pull off this all-night party that is just a massive task. So,
For the past 23 years.
very proud of her school.
I'm just going to mention, I know you've heard a lot of interventions that are going on this evening, things that different sectors are doing, and I just wanted to put out there that Atlantic Care today emailed me that they have agreed that with the Partnership for a Drug-Free New Jersey to host a Do No Harm Symposium for all physicians in South Jersey. And we're scheduling the date for that because we do know that a lot of times these prescriptions are starting with the doctors. And there's also, and there are flyers out there, on October 6th, the first ever Knockout Opiate Abuse Day. And this is going to be coordinating volunteers in each county throughout the state to put up these door knockers at people's homes. And the idea is before they prescribe, you decide. Encouraging parents that when their child has a wisdom tooth pulled, when their child has a sports injury, and they go to the doctors, to make sure they have that conversation about what the physician is prescribing. A child who is getting their wisdom teeth pulled out do not need 30 Percocet. And that is one of the issues that we're facing when parents do not understand that a doctor is prescribing something, but that does not mean that the child needs that entire medication. So, and that's how then we're ending up with things in our medicine cabinet and things being taken. So I just want to kind of put out there those two things. And the other thing is we just had, and these are out front as well, these were picked up from the printer today. We've ordered so far 10,000 of them. These are the information from the American Medicine Chest Challenge about permanent drop boxes and cleaning out medicine cabinets. We have been working with every realtor in the county, funeral homes, and now moving on to hospices to get this in the hands of the people who, when they have lost a family member, how to clean out the medications for the hospices as well, and the realtors during open houses. So this is a new campaign we're doing, but we're also encouraging every town hall, every school, and anywhere else in Atlantic County, even pharmacies, to have these cards. We have 10,000 of them as of right now. They were just picked up from the printers today. We will print another 10,000 if necessary. So we want to encourage you to take a lot of these and to start distributing them throughout the county. I'm going to turn it over one more moment to Committeeman Armato, and then we're going to open it up to the public portion.
Thank you. Just a couple of quick things. We do get credit for our drop-off box, being the first one in the state that's not in a police station or hospital or pharmacy.
I think nationally, I'm going to say that. Every time I'm anywhere, I ask at national conferences, no one else has one that's not in those locations.
I just want to emphasize that this was a joint effort between our township and the Sheriff's Department. Sheriff Ballas was a great help. But nothing we do here is singled out. Mayor Cirillo, Deputy Mayor Teresa Kelly, Committeeman Steve Martinelli, Committeeman John Williams, and myself, we're all on the same page. Our job, for a better word, is the caretakers of Buena Vista Township. We take it seriously, and we work and we strive for that. San Mazzio, it is a great effort to have these Narcans in high schools. Well, Buena High School already has it. Our Township Hall has it. Our King Center has it. Buena Vista is out front, and that's where we want to be. We do as much as we can for the public, and we do it the best that we can. In my effort, we also have a support group, and it seems like most things revolve around churches. Reverend Mallory has an Alcohol Anonymous. Pastor Albert at the Abundant Living Church has a codependent meeting for Naranon. It's on Thursdays at 6:30. That's for the families of. We try to educate and just get an ear for them to vent once in a while, and that's what they really, really need. It is a family disease. Not only does it affect the addict, it affects the entire family. The 3 C's. You didn't cause it, you can't control it, and you can't cure it. So, try not to beat yourselves up. As parents, we do what we think the best is, and then we just offer help and support. And one thing that we in our group is, you never stop loving. You never stop hoping. So, thank you.
All right, and I would like to especially thank Committeeman Armato because he actually attended our event that we held at the Mays Landing Public Library, which was an opiate task force public meeting. And he approached me right afterwards and put out there anything that you need, anything that we can do in Buena, and then actually asked about us bringing this to you here today. So I want to actually thank him, publicly for all of his efforts that he's doing here in your town. At this time, I'd like to invite anyone from the public who has a question, if you would like to come up to the front, or even actually it's a small room, so if you want to just stand in your seat where you're located at and actually ask the question. Yes, sir.
Good evening, my name is Elder Robert Jackson from the Seventh-day Adventist Church here in Newtonville. I attended my first Municipal Drug Alliance meeting where I met John Amato and a few others. Gia Halls, I think, invited me. So I'm glad to have been to this meeting tonight. My question has to do with youth. Let me preface that by saying our church is interested in what's going on in Buena Township, and I think I expressed that to John Amato at the last time we met. And so my purpose right now for coming to this meeting is to find out more about what we're discussing tonight and how we can get involved in helping youth. I have also tonight our first elder, Devin Thompson, who also came to this meeting tonight. But my question to you is, it has to do with youth. Now, I heard you say earlier that you don't have any or very few facilities for youth here in this county.
Correct.
And the youth have to go outside for, what's that, for beds?
Yeah, I will just mention, because I know Reverend Mallory asked me, Lighthouse had an inpatient treatment center. They were bought out by Recovery Centers of America, who did close the adolescent unit. That was, a big issue here for Lennon County, as well as there was rehab after work or rehab after school. That closed. There was one other outpatient facility for youth that closed as well. And there's also a large issue with the fact that youth can actually refuse treatment. And so if you're thinking of a young brain, a young teenager who is in the midst of their addiction is allowed by law to refuse treatment. So, I mean, that's something that, legislatively needs to be looked at. So yes, that is a big issue. I know there are some talks and people, constantly trying to bring some type of treatment for adolescents back to the county. But Tracy and I, we actually had been running a youth support group out at Hope All Day. We had, at one point up to 20 students, 20 adolescents attending. Lighthouse was bringing them and several high schools were sending people. But then after Lighthouse closed, the numbers dwindled. We only had 1 or 2. And at that point, if the students aren't being told, before you can come back to school, before, as part of your station house adjustments, you must attend a support group, we ended up, not having any youth showing up and had to end the program. So, it is a big issue. So that's where, the youth groups, here in the county through the organizations are great because sometimes it may be the only place that our youth can go.
Okay, at this point, we're in the just the listening, so we can learn more about, what's being involved, but probably in the future, I would like to know or speak with someone about how we might be able to help youth in this drug addiction problem.
Thank you. Judy?
I just want to share that if there is a concern in the school district, and we feel that a child's under the influence, and we test the child, and the child comes back positive, we do mandate that they have to go see Jake or George at that triad program, and then in order for them to be released from their contract so that they can continue with school and graduate, they have to be clean. So they have to actually have clean urine screening with Jake, and also Jake has to release them. We also put in the contract that they have to see Jake. He does a urine test, but he also does a SASE, it's like an assessment. And in there, they kind of ask the same question a few different ways so they can kind of rule out someone trying to trick the system. And if they feel a child needs more, in our contract it says, try it or whatever their recommendation is what the student has to follow. So I think the loophole is the kids that aren't being identified in school that are out there on the weekends using,
Right.
That there isn't that mandate.
But Judy, I'm just gonna interject here, right?
Yeah.
So this, you've heard a million times, right? It's a community effort.
Yes.
And if you, sir, can start a peer-to-peer group within your organization to help support these kids, you know, go for it. Because the more support we have in the homes with the family, at school, like Judy does, in the churches, the hospitals, the ER, the police officers, that's what's going to help solve this. It has got to be a joint effort. So, you know, look into it, and there is supports for church peer-to-peer and youth groups that specifically address drug and alcohol issues in the family. And it can be not just the kids using, but about all the poor kids who go home to a mom or dad who's using. I mean, it's all ages. It's everywhere. So I would encourage you to look into that. It would be awesome.
Thank you.
One other thing I just mentioned, I sat recently on the roundtable for Stockton's recovery housing. It's part of a state mandate that all universities with a certain percentage of students who live on campus has to offer recovery housing by, I believe, 2018. So Stockton's actually trying to put that into action even quicker than the state mandate. And they are looking at some type of support groups and offering more things on campus. So at least maybe it is young adults and it's the college age with high school mixed in, as opposed to some 15, 16-year-old going to an AA meeting where they're the only person under the age of 30. And so we have to really kind of target, that is a very big issue, to have youth feeling comfortable with that peer-to-peer support. Any other questions?
I just wanted to thank everybody. I'm Teresa Kelly, and John, you did a great job getting this panel together, and our high school representatives are very happy. Really went well. We're going to be showing this on our TV channel for the people that didn't come. The only question I have is, and I don't know who can say it, is for the public, when someone has a problem and they want to get help, can someone go over the steps that they would know what and hear what they could do, or what would the process be for someone now maybe watching it later, what they could do, and a step process.
Wow.
Yeah, I'd like to answer that. On the table right outside the door here, you're going to see a brochure that says recovery is possible with one call. This is something that we hand out to patients, to families, to providers, hospitals, primary care physicians. Make one call to us. We're going to do our best to help you in any way that we can. And if for some reason we can't help you, we're going to find resources and information that can help you. So we're available 24/7, 365. Just call us.
Sean, for those who are not here in attendance tonight and will be watching this, can you actually say what is the number?
Yes, the number, my card with my direct line is on that table. We also have a Seabrook House phone number, which is 856-455-7575, and our call center extension is 1515.
Thank you. That is one other thing that on the coalition, we already doing a substance abuse resource guide for all police departments to give out on any calls, as well as the town halls. And at our last public meeting, the director of the EMTs said that all EMTs should be given the resources for treatment as well. So that is something that will be coming out in the next couple of months.
I just want to add, I think that's really important. Through my career, especially starting out when I was a young trooper, making arrests, people, drunk driving, there's pills or whatever the case was. A lot of people when the person would get picked up by a family member, the family member would say, I know he's had a problem, I just don't know what to do, I don't know who to call. And to be honest, I didn't know either. I'm sorry, there's got to be something, look it up, or you can maybe call this number. I try to give them something, but I really didn't know. And then, the next time I'd arrest the same person, or that same person would be in the station, and they'd say, we tried a couple places, but we don't have insurance, so we can't get help. And, I always thought to myself, well, there has to be something. There has to be an answer. There has to be somebody that you can call. But, stuff like that, like we all need to educate ourselves in knowing, how to help people that have these problems, and, know what to tell those people and who to call, and try to, encourage them to follow through. And, you may not get an answer the first time. You may not you know, you may not get the help that you need the first time, you know, call again, you know, call, you know, Seabrook House. If they can't help you, they seem very passionate that they would, you know, connect you with the right person that can help you. So.
One of the other things that we're just finding out recently, just through experience of patients that are coming in, is if someone is Narcaned and they are brought to the hospital, they are required now to give them a referral and get them some help. So it's not just a drop and run anymore. That's how we're finding out a lot of patients, once they've been Narcaned, we're getting the referrals because they're actually have been Narcaned and they have to give them some information. So that's a good initiative that the hospitals are actually taking in the ERs.
I just wanted to say that there's an agency in every county, in our county, it's Juvenile Family Crisis. I mean, some of the first things that your child's gonna do is they're gonna not come home curfew time, they're gonna not follow some rules of the home that they used to follow. And I tell parents all the time that that's a free service. I know the phone number by heart because if a family calls me, this is the referral that I give. It's 609-645-5862. It's for juveniles because what they do is they have a social worker, and the child has to be willing, you know, the parent has to be willing. Even if the child says, I'm not getting in the car with my mom or dad, I've had the police department bring the kid and the parent meet the child there, and Juvenile Family Crisis will meet and negotiate a contract between the child and the parent. And it actually has the leverage of a juvenile judge. So if in the contract you have to be home by a certain time and you're not, and there's substance use, it's gonna come up. And that could be an opening. Also, schools have substance awareness coordinators, and we're bound by a law, 42 CFR. And the reason why New Jersey came up with this position is so that families and children would feel that they could talk to someone in the school and get help. So I'm the SAC certified person at Buena Regional High School. So unless a kid is under the influence at the time that they come and talk to me, that child can share with me what they're doing so that I could give them education and referral and work with them. I've had kids tell their family with me. They're afraid to tell their parents by themselves, so we have the parents come in the school. But I can't call mom or dad. I can't say to, you know, the principal, drug test this kid because the kid told me that they used on Saturday night. And so I really want to encourage you to use those SACs within your school district and call them. You're not getting your kid in trouble. You're helping get your kid out of trouble by calling the SAC at the high school.
Is there anybody else has another question? Yes, sir.
I'm Mayor Chuck Chiarello, and I also wanted to say thank you very much to this fantastic panel that is here tonight. And the good thing about these two cameras that are here tonight, our local cable goes into 5 towns altogether. So you may hear from people from Folsom or Waterford or Monroe Township or Chislehurst and Winslow Township. The other camera here is from SNJ Today out of Millville, and they are an up-and-coming force in this area for media in getting out news to Cumberland County, but also news throughout all of South Jersey. And I too want to pay compliments to Committeeman John Armato. He has taken this under his wing, partly as a life calling and partly as destiny, but he's done a tremendous job in taking this whole program forward. I do also want to acknowledge the fact that we have from Buena Borough, our neighboring town, we have Council President Rosalie Baker here with us tonight, and also from our other neighboring town, Weymouth Township, Mayor Ken Hazer. And I know we also have School Board Member Barbara Myrick, from the Buena Regional District, as well as the wonderful Kim Albert and Judy Benefro. If I missed anybody, I don't want to get into any more trouble, but I do want to say thank you because I know we're getting to a later time in the evening here. Thank you.
Also helping Smith from James.
Oh, Bob James is here?
He's right there.
See, Bob is hiding behind the camera.
He's
Sorry
happy
not
with
to
that.
say- That's why I said you get into trouble when you say this, but thank you.
Thank you, Mayor. And with that, I would like to thank everybody for attending tonight and thanking the panel for being here this late hour. And if you have any questions afterwards as we're leaving, then take advantage of the resources out on the table. Thank you.
Get a lockbox, get a lockbox.